So today is the Saturday before rotations and kind of nervous but super excited. I'm sorry I look grimy this morning, but this is how recovery looks like. You just gotta accept it sometimes. On Monday, I will be heading to school from around 8 a.m. to 10 a.m. and then I head straight to my first rotation site, which is primary care, and it's around like 45 minutes away. So I'm pretty excited. So I just wanted to show you, I did a little whisk of matcha. I did 2 scoops because yesterday I did miss my dose of matcha. So I'm trying to make it up today. It doesn't really work that way, but I'm trying to believe that it does. Let me show you. Bam! Look at that. Look at that green. Hello everyone. It started raining, so we're at the mall. Learning about people and their lives because life is just too short, and I think that it's really interesting to learn about people's goals and how they came to be and how they grew up. I'm going to go interview my friend right now, and you're coming with me. Okay, see you in a bit. Okay, here we go. Let's get driving. Today we're going to unbox a ThredUp package. I've been using ThredUp since college. First it was kind of hard to find something that I love from ThredUp, but eventually after a few tries and like knowing how to basically work the app and the algorithm with AI, ThredUp has made it super helpful to help you find the style that you love. It makes it super easy. There's like a chat box that you can use. If you don't know what ThredUp is, it's basically an online consignment store where you just thrift online and you can heart the item that you like, and sometimes it's like a little game because you heart it and before you know it, it may be bought super quickly. It's really cool because you get to find all these special and unique pieces where you won't be able to find elsewhere. Let's unbox this. This is a clean out box, and then you basically send it back to ThredUp so that you can clean out and declutter your closet. Okay, so this is the haul for today. We have a belt from Free People with tags on it. For the longest time, I've been trying to find the perfect belt, and here we are. ThredUp really guaranteed it. And then for number 2, we have a peplum top from Zara. We can basically pair it with a white pair of dress pants, and I think that'll be really cute. Lastly, we have a pair of super low loose pants from Levi's. It also has the tags on it. I've been looking for these like wide leg pants. I just love flowy things. Like, what can I say? It just speaks to me. Good morning. It's the first day of rotations. I'm currently going to drive to school for orientation. See you in a bit. Bye. Okay, we just finished orientation. Now I'm going to drive around like 46 minutes to the site. Excited to meet the preceptor. She seems really nice and wonderful. Kind of nervous because I haven't really remembered all of the USP STF guidelines, but it is okay. I'm going to listen to a podcast called Divine Intervention. I heard it was a really great way of remembering and refreshing important conditions and how to rule out certain diseases. Okay, I will see you in 46 minutes. It is currently day 2. I just got back home. It's 5:33. Primary care so far is super busy. I'm learning so much from patients and also different USPSTF guidelines and learning about when to do mammographies, what is the gold standard to screen for colon cancer, which is the colonoscopy. I packed some lunch, but I didn't get to eat it today, so I'm going to eat it now.
Hi everyone, it's currently Friday. Well, you can probably guess from that sound, it's currently the end of day. It's 6:21 p.m. It's been the first week and some reflections. It's fun to meet patients and hear their story. Presenting a SOAP note, where SOAP stands for like subjective, objective assessment and plan, to present like the patient's history and physical exam to the faculty member or the attending. At first it was a little nerve-wracking because I haven't done it in a while, but after this week it felt a little better towards the end. Definitely still have some work to do. Currently horizontal, which is kind of funny. I was not expecting to be horizontal. I usually really love to stand, and I did get sick. It's probably from a mix of stress, new environment, meeting people. I came back home and I cleaned the bathroom. There was just something in me that felt like, you know, it's time for a cleanse. Oh yeah, a funny story. On the first day, I accidentally got locked out of the clinic because people from the front desk and the nurses, they all went to lunch and I forgot my coffee in the car. So I went out of the clinic and went to get my coffee, and then bam, I was locked out. I was just chilling with the patient outside in the parking lot. So whoever that happens to as well, it's okay, it happens. Okay, I'm going to go take a nap now, so I'll see you next time. Bye.